Welcome to today's session of WTS online seminar series, How to Animal Welfare. This is the fourth session of this series, and we're talking about animal welfare and food safety in smallholder pig farming systems in Uganda. I'm your host. My name is Karin Siegmund. I'm the director of WTS. WTS is a German foundation promoting animal welfare worldwide, and we are based in Berlin. This session is part of our program Animal Welfare and Development Cooperation, which we started in 2019. The last year was very important for us because we developed guidelines on implementing animal welfare in development cooperation projects, and these have been presented at the Africa Animal Welfare Conference in Botswana in November, and we are very happy that we had the opportunity. We support practice projects, trainings like this one, and also research, and one of the research supports will be discussed today. This series is aiming at improving animal welfare in practice, and so I'm very happy that we have the experts today. You'll find all the previous sessions on the web. Today, we're going to discuss a very interesting research and its implications for communities, for farmers and consumers alike. And we are having a look at this long neglected nexus between animal welfare and other areas like food safety, food security, and health, which is still pretty new, but very important in order to improve animal welfare in the field. Meanwhile, I would like to introduce Dr. Paul Suna to you. He is the director of AWECA. This is the Animal Welfare Competence Center for Africa at Makerere University in Uganda, which is being supported by WTS and WTG. Paul is a long-term partner of WTS. We collaborate on many projects on animal welfare issues and hope to do more through the center. I would now like to hand over to Paul. Thank you all for being with us today, and Paul, the floor is yours.
All right, thank you, Karin, for that kind introduction. I also want to add to that to welcome our participants for this webinar that we are having today. The theme for this webinar is looking at the role of animal welfare in food safety, and is specifically looking at smallholder pig farming systems. Now, before we start off, I would like to interest us with what the WHO says about food safety. It says that food safety is about having sufficient amounts of safe and nutritious food which can sustain life and promote good health. And in fact, WHO further highlights that over $110 billion are lost each year in productivity and medical expenses that are resulting from unsafe food in the low and middle income countries where this research was actually carried out. And about 1 in 10 people in the world are falling ill after eating contaminated food. So therefore, these foodborne illnesses clearly impede socio-economic development by straining healthcare systems and harming national economies, tourism, and trade. So what then is the role of animal welfare in food safety? Animal welfare and food safety are inextricably linked in that threats to animal welfare, including stress-induced immunosuppression among farm animals, genetic modification, among several issues, have the potential to compromise the healthiness and safety of food. So therefore, Mr. Stephen Kakooza's research is contributing to understanding this further, where he determined and evaluated selected food safety indicators for monitoring animal welfare in pigs, and he used that data to create linkages between on-farm welfare scores and the occurrence of these food safety risks in pigs. Mr. Stephen Kakooza is a public health microbiologist. He is deeply committed to improving the health and well-being of communities around the world. He has made over 10 years of contributing to the field of One Health research, infectious disease diagnostics, and outreach. He has an academic background in biomedical sciences and preventive medicine. And he works with Veterinarians and Frontiers Germany under the BMZ-funded project boosting Uganda's investments in livestock development, where he continues to dedicate himself in the battle against global health security threats, such as antimicrobial resistance and zoonotic diseases. With new research dimensions, he seeks to provide solutions to the worrying food safety outcomes in Uganda through blended interventions linked to animal welfare. So please join me to welcome Stephen to make his presentation today. I will be the moderator for this webinar today.
Thank you, Paul, for those remarks, and I'll now go on to share my screen. So I hope my screen is visible and I'm also audible enough. Okay, thank you so much for taking time to attend this webinar. And once again, good morning and good evening and good afternoon for wherever you are joining from. It's always a privilege for us to come and share pertinent issues regarding animal welfare and health, linking them with public health outcomes. I will not introduce myself again, as Paul has done really a very good job in doing that, but I work with VSF Germany, and today's talk will focus on animal welfare and food safety. Thank you so much, WTS, for organizing this webinar. So animal welfare is quite a complex subject, but according to the World Organization for Animal Health, it is defined as a physical and mental state of an animal in relation to the conditions in which it lives and dies. And you could find a lot of information regarding animal welfare from current and past editions of the WOA terrestrial codes. So the WOA is also a good and very instrumental body that is guiding welfare implementation in a number of countries. And according to their strategy, the objective is to achieve a world where welfare is respected and promoted and advanced in ways that really complement the pursuit of animal health. And also this has gains for us as humans and the environment and the socio-economic development in nations. There are also the 5 freedoms and the 3 R's, which are key domains that are actually important for us when we are doing animal welfare work, and for whatever purpose that humans are using these animals for, it's important that these freedoms really come into play. So animals really play a number of roles in the lives of humans, but most of us will always look at them from the side of food. And future projections are showing that by 2030, there will be a high demand for meat products in a number of developing countries, according to a study by the FAO. And this is already happening. The issues with it, and with the intensification of livestock production systems, people are doing a number of unfriendly practices that could actually impact disease in these animals, which has also effects on the public health and other outcomes. However, the WOA actually stresses it that improvements in farm welfare can often improve food safety and economic benefits, and this should actually be, animal welfare should be looked at as one of the key pillars to addressing these issues. So I'll now talk about the TRAWIFS initiative that was done in Uganda. And TRAWIFS in full is the role of animal welfare in influencing food safety. And this was pilot funding we received from WTS to take us for work for 6 months. And objectively, in why we really came up with this initiative is the current wave of government support. Really, a number of operation wealth creation schemes have been done to increase the volume of animal products on market. But this, of course, has a belief that it will increase also economic gains for the natives. But there are unseen priorities that are not really given a lot of attention, such as issues to do with public health risks in these and how we can monitor and control them. the farmers are really unaware that actually animal welfare can actually have impact on the stress and also cause these diseases, and then also there are issues with zoonotic pathogens being shared by farm animals, and also the current menace of antimicrobial resistance also coming into play. So in the long run, their livelihoods are directly affected, but welfare is not taken care as a key thing that actually they should do. So we chose the pork value chain as a pilot place to start from, because actually pork is one of the most consumed meat types in Uganda. And we believe that advances in animal welfare have the potential to reduce risks to food safety, particularly on farm, but these are found lacking on a number of developing countries, Uganda inclusive. So this has a forecasted actual impact on the quality of the animal products that we will be consuming in the next years to come. And of course, there are issues also with trade bans that are done for some of these products, which has a negative economic impact. So objectively, we sought to demonstrate and strengthen the role of on-farm animal welfare practices on pork safety in Uganda. And we came up with a couple of indicators that we wanted to first monitor, then link them with our welfare situations that we found. So in our work plan, we visited farms from different settings in Wakiso and Mukono, and we collected samples which were submitted to the lab for a number of tests. So descriptively, these farms in Mukono are mainly owned by men, and a majority of them are actually smallholder, although our target was intensive, and we were surprised that many actually were smallholder. So the different indicators that we chose, and we the different indicators, sorry about that, someone probably should mute themselves. The different indicators that we have chosen, we tested them, and one of them being hemograms that actually provide information about cells in the system to aid diagnosis of abnormalities. And we found out that actually these pigs are really stressed, with a number of stress-related hemograms that we could find in these herds. The other thing that we found was a high prevalence of hypoproteinemia, which is actually highly linked with gastrointestinal parasitic diseases and the nutrition issues that were so much popular with these farmers. We also went forward to look at the levels of stress in these animals, but of course, the current issue is that we don't have baselines as a country, and we look forward to actually being able to achieve some of those issues. The prevalence of gastrointestinal parasites was very high, and we see that a number of pigs with when we counted their eggs per gram, many of these had to be dewormed, but they were literally living normally on these farms with no interventions being done. Of course, farmers also complained about issues of antihelminthic resistance, which we will also try to talk about maybe in one time in the future. Salmonella was also very highly common, especially on the farms in Mukono, and we detected almost close to 6.3% of the prevalence. The burden of antimicrobial resistance was also very high on these farms, and we quantified, and together with qualitatively getting this analysis. And we could link these actually to the poor biosecurity that we found on these farms that could drive this burden. As you can see, actually, in the last picture, that picture, pigs are actually interacting with chicken due to the poor structures. So we also went on to use modifications in the EU tool, and we were able to score welfare in these different parameters: feeding, housing, and health, plus behavior. And we found out that there was, this is preliminary data, but we are going on to do further scoring for this data because it's quite robust. but it shows that the performance indicators show that there are issues. When we compare the two settings, the Mukono farms were doing very badly. And a number of welfare conditions we found on these farms. And this, of course, is linked with the notions like castration. People think tail docking is important in fattening animals. In that picture where you're seeing a prolapse, that farmer almost cut off that prolapse because there was no access to veterinary services. So in all these indicators, we eliminated out fecal parasites because we could not find any zoonoses that we could link to these animal welfare, as most of them were not zoonotic, linked with pork safety. So looking at one parameter, which is hypoproteinemia, it's actually associated with nutrition and parasitic disease, and this was higher in Mukono, where actually we noted even the pigs had poor body condition scores and also high fecal parasites in their stool. So of course it has an issue with the production of immunoglobulins, which are important for immunity. And the solution we give farmers is to improve their housing. Their deworming programs are also a problem, and other issues also with feeding that we could actually talk about. So cortisol is usually released in due to stressful conditions occurring in these herds, and it as a hormone has an effect, of course, on immunity, the gut microbiome, and also permeability of pathogens infiltrating the intestinal lining. And we found out that, of course, there are issues with feeding, housing, and behavior that could affect this, but also when we did some associations, there are putative associations that we found between stress and pathogen shedding. And this ideally is good for precision medicine, where people could further go into looking at bacterial stress responses as potential targets in overcoming antimicrobial resistance. Of course, research has already been shown that this can be done. Salmonella in herds is affected by a number of factors, but the key thing is stress that affects the immunity of these animals. That's impacting the fecal shedding of these parasites. What farmers could do, and the key thing is stress management and the animal husbandry practices with much emphasis on capturing good biosecurity. As you can see, that is a footbath which is non-functional. And you see on that farm, the chicken, because of the structure that was actually damaged, can enter and also interact with these pigs. So there is exchange of some of these pathogens. On some farms, we could also see evidence of other vermin like rodents and rats entering these houses. So in conclusions, we were able to establish a number of linkages between the fecal shedding of zoonotic pork-borne pathogens such as Salmonella and drug-resistant E. coli and animal welfare. And as we think about boosting pig farming in Uganda, the potential contribution to the prevalence of zoonotic agents in pork has to really be addressed and should be corrected, especially as issues associated with animal welfare. It is also important that national food safety plans and guidelines really incorporate animal welfare in their strategies for promoting safe meat on our market. So if you look at the WHO Global Food Safety Strategy, and you read further into this document, you'll find that animal welfare is actually just talked about in just a small section of this document. And we don't know, probably these technical teams need to sit down and really invite welfare experts, and this should actually come out as a core, not as a small a brush-on statement that is being promoted. So my take-home message is for the farmers is awareness on animal welfare is important, especially best health management practices. For the extension workers, there is really a gap in the capacity for veterinary services, diagnostics, and adult monitoring. Of course, even the numbers are really very few for the work to really be done in the field. And the sensitization of these farmers in adult monitoring is important. The researchers actually need to go on further to do baseline stress studies, especially issues to do with detection of cortisol, which hasn't really been done, and other testing of protocols on cortisol detection. So more research on bacterial stress responses as potential targets for infectious diseases and also antimicrobial resistance can actually also be looked at. For the policymakers, integration of animal welfare as a core in national food safety plans and guidelines is actually important for them to really get this rolling. I would like to acknowledge the different partners that we worked with in this research and the funding that we received from WTS, and it was really instrumental. Makerere University, the Animal Welfare Competence Center for Africa, Dr. Sarah Hall at the University of Edinburgh, and Dr. Christina Rosso and Dr. Annie Cook, who supported us also in the starting of this work. Yeah, thank you so much for listening.
Right. Thank you, Stephen, for this wonderful, very insightful presentation. You have evidently showed us how aspects of feeding, of housing, of health, behavior that the pigs express on farm, or rather during transport, could have an effect on how safe or nutritious our food could be.